Welcome. I'm Diane Newman. I'm an adjunct professor of surgery and research investigator senior at the Perelman School of Medicine at the University of Pennsylvania in Philadelphia. And I'm presenting my research on a continence care registry called ConCaReTM. And this is for what I will be presenting at the SUNA uroLogic annual conference, which will be held at the end of October in Phoenix. This is actually a survey of individuals who are performing intermittent self-catheterization. We're trying to determine what is their experiences over time. This is a 5-year longitudinal survey of patients, men and women, with neurogenic and non-neurogenic lower urinary tract dysfunction who are performing intermittent self-catheterization. What we're trying to determine is really real-world data, their experience with intermittent catheterization. And we are using certain questionnaires as far as quality of life, and I'll go over those in a minute, and other questions that we're asking them. This does occur over 5 years, so we're going to collect longitudinal data. This has been IRB approved, and the funding is through Hollister. We will be doing this survey in the United States. We started Canada, UK, so US, Canada, and UK are now in operations. We're moving it to France, Italy, and Germany. So it really is an international survey. We're using the intermittent self-catheterization questionnaire that evaluates quality of life in patients with chronic urinary retention who self-catheterize. It has 4 domains: ease of use, discreteness, psychological well-being, convenience, and the scores are from 0 to 100. We're also using the European Quality of Life 5-dimension questionnaire. And this is really 5 different dimensions, including mobility, self-care, usual activities, pain, discomfort, anxiety, depression, and they rate their overall health. And this questionnaire is really great because it's translated in over 130 languages to determine the quality of life of these individuals performing intermittent self-catheterization. We're also using the RAND Modified Medical Outcomes Social Support Survey, which is really designed to evaluate social support in community dwelling chronically ill individuals. And it also has 4 domains: emotional, informational support, tangible, instrumental support, positive social interaction, and affection. And so you can see that we're really asking quite a bit of questions of these individuals because we really want to determine what's going on with them. We started this journey of our ConCaReTM in 2021, and it will go for 5 years. The pilot study was completed in Q4 21. We started enrollment in the US in Q1 2022. We opened up Canada enrollment in the second quarter of 2022. And actually in the first quarter of this year, 2023, we have opened UK enrollment. We're expanding it, though, into other European countries. To date, I'm going to present some of our initial pilot data. We have enrolled 157 individuals. We have attrition of 6, and we retain 151. You can see by this slide the breakdown between US, Canada, and UK. Right now, US leads because we started the survey first in the United States. Canada is catching up, and UK has just started. So you can see the breakdown there. I have a little bit of data to share with you. Gender, it's mostly men, and it's mostly men with spinal cord injury. You can see 65% are males, 35% female. Average age is 51.28 years. So we'll see, but it spans from 20 to years, 86. This shows you the breakdown between neurogenic and non-neurogenic. You can see that we are mostly neurogenic, which is the red of the first circle. 53% have reported spinal cord injury. And we asked them what the length of time they've been performing as far as the length of time since their spinal cord injury, of those who had a spinal cord injury, and it's been 10.54 years. So you can see that these individuals are living longer with their injury, such as spinal cord, and that they are performing intermittent cath. One of the other questions that we asked that we have data on is the length of time using another method to empty their bladder, and you can see that they initiated less than 3 months is 22%, and you can see that breakdown. Who recommended that they start intermittent self-cath? 55% were recommended by a urologist, with 17% by primary care, 15% by other healthcare professional, and 13% by nurse. I think as we go into other countries, this may change. I think in the US, you do see mostly urologists recommending that individuals start intermittent cath. And then we were interested in where they learned their first training. 76% were trained by a nurse. I think this is important for urology nursing because that's usually who does initiate intermittent self-cath. And there's a breakdown of other individuals, with the next most common individual first training that patient was urologist at 8%. So this is a very short synopsis of this research that I will be presenting at the SUNA meeting. Please, I hope that you tune in, either come to the meeting or come in virtually so you can have more information as far as where we're going with the ConCare Continence Care Survey on individuals with intermittent catheterization. Thank you.